Good evening, one and all. I sincerely thank the Madras Management Association, particularly President Dr. Master Mahalingam sir and Group Captain Vijay Kumar sir for giving this wonderful opportunity. So I'm an MMA member there. So we do a lot of programs through my startup call. I'm a doctor entrepreneur there. I got a startup called Best of IDs there. We are transforming infectious diseases care to the most of the people. I'll come back explain what we do in a couple of minutes later there. Before that disclosure, this is a disclosure of me. People are talking about infectious diseases. How many know what is infectious diseases? Because my daughter used to find very difficult to explain what specialty your father is practicing there. When somebody asks infectious diseases means what infectious diseases? We know cardiologists, we know gastroenterologists, we know neurologists also, nephrologists also. But what is this infectious disease? ID guys. So what is ID guys? What do you mean by thing? So she explained that. She said, please change your specialty there. That's what she used to keep on telling me that. It's very difficult for me to do. So, and I put something called, because I'm talking in a management association, so we need to talk in terms of some intelligence quotients and emotional quotients we want to know. This is called HIM. What is HIM? All stuck managements. This is husband management quotients with wife there. So I know how to tackle. So if I know this one, it's easy to tackle anything there. That's what we used to say there. All husbands know this tackle there. All married men knows this one. So this is most intelligent needed for us. Okay, then I call about, what about ID specialists there? Infectious disease doctor. In short, we are fever specialists there. Any fevers from 1 day fever to 10 years fever or 25 years fever also we tackle it. That's more important. We don't deal small fevers like dengue, malaria, chikungunya. This is bread and butter for other physicians. But we do complicated stuff like transplant fevers, HIV fevers, and hospital fevers, nosocomial fevers. Even corona gave a lot of idea about what is infectious diseases there. We are the specialists for dealing with COVID and corona. But unfortunately, if you see our earning, we are in the bottom. So the specialty doesn't earn, it's like a HIV, ID, these are the specialty, we don't make money. But we try to solve the problems. Any problem, anybody has got it. For example, anybody in the hospital has got fever, and the physician 3 days, up to 3 days, or up to 5 days. You people are happy to go to physicians. The physician's also happy to deal with the fever. Once your fever crosses more than 5 days, both the physician is jittery and you are also jittery. What is going on? So he struggles there. That's the area we can solve. We use our brain. We are not ID, we are CID, we can put it there. How criminal investigations we need to do. Similarly, we investigate your body and tell what is going around, but we don't make big money because we don't do any procedures, so we don't make big money. Okay, so I'm talking in the evening time. I'll just put in a management perspective there. This is a 32-year-old male, CEO, chronic stress, irregular sleep, frequent travel, recurrent colds. Does he need some immunity intelligence for this scan? How many says yes? Or I didn't put your Mentimeter is there. I just forgot the Mentimeter. Otherwise, I know the response is fine. Show of hands. Another is a 55 female senior manager, sedentary lifestyle, high carb diet, post-COVID, Jan 22, still fatigue, memory disturbances. Typical post-COVID or long COVID. People say, I used to remember anybody, any name, but now I'm struggling to recall your name there. So people still, lack of taste, lack of smell still going around. This is called long COVID. So 25-year-old management intern, living with pizzas and burgers, pani puris, active in Facebook, Instas and Gen A's. Anything you want, he's not searching Google. He searches only ChatGPT and he searches Perplexity for finance deals there. For everything, on and off diarrhea. What do you think? The pani puri is causing on and off diarrhea there. So it's called classic of typhoid then. 45-year-old female, HR head, post-menopausal, weight gain, 24/7 on mobile, but she got recurrent UTI. UTI is not leaving her. Every third month or every second week, he got UTI. So what do you think? Who needs immunity intelligence here? So, third and four. Okay. All of the above. Always when you give a multiple choice questions with all of the above, none of the above, always attempting will be there. So those who hand NEET examinations, this knows. So this is a problem there. And similarly, the first answer is always tempting there. First choice is the best choice, no? So always think about it. And he's a CEO. So whether to give importance to CEO or intern, what are you going to do now? So all of the above is a answer. We need to talk about infections, immunity to everybody. Everyone, whether it's a CEO or intern, I don't bother. We need to talk about immunity to everybody. That is why we are aiming at this one. And second thing, you can't Google it, you can't chat GPT this one. How to improve your immunity is give a lot of things. My interesting person has told a lot of things is available, a lot of myth is available, a lot of misinformation is available. So we need to sort it out, what is immunity and how to prevent it. And what is your intelligence also, we need to talk about it. What are all the factors this affect? I do a different stuff, but I'm doing a different thing here. I actually wanted Dr. Madhu to talk this one there. Madhu said, no, I don't want to do this one. My specialty is vaccinations. I go with vaccination there. Because this is the most difficult thing there. So I want to simplify the most difficult thing. That's what I do, this one. Okay. What's basically immunity for you? I need to speak to the management guys, means this is your security guard. So basically it provides your internal security, prevents something coming into your body, one. Second thing, whatever comes, it knocks out as early as possible. And third thing, it has need to be memory. It should have memory, so this thing should not happen. Once it allowed, but next time it should not allow it. So this is basically 3 things you should do. What are all the types it has got? One is called innate. For example, your skin is a beautiful protection. Beautiful. That's why burns patients suffer a lot of sepsis and a lot of infections. Why? That is one of the first and foremost defense. Unfortunately, we do not know the skin is a good defense. Your lacrimations, your tears is a good immunity. Your saliva has got a good immunity. So these are all called natural innate immunity. They are all non-specific. They can hit anybody. They can prevent anybody. Adaptive is like your AI or is your legal system, your legal team. The legal team scrutinize everything, do perfect things and avoid unnecessary things. That's called an adaptive thing. Once you got it, your immune system start developing it. Sometimes you don't have immunity, but you want to have something, somebody want to give it. That's called passive, getting a loan to solve your problem. Getting an umbrella while walking in the rain, you don't have on it. That's called passive. For example, mother's immunity goes to the child. When the newborn, when the baby is delivered, how the baby has got immunity? Nothing. The baby's immune system should develop minimum 5 to 7 years. Till that time, where is the immunity? The breast milk. That is the immunity for the child. That's a child. And second thing, the care of the mother. That's called kangaroo care, we call it that. The mother should closely hold the child, give the comfort. That is the immunity is getting from the mother is called the passive one. Then vaccines, yes, I'll come back a bit last part because that's a favorite for all infectious disease docs. Then goal is we need to fight the immunity and remember the immunity. That's more important for me. So nowadays we are using, previously during COVID time, this is a common scenario. I think MMA also used this one. We did a study there, useless. So don't do this useless. We screened almost 45,000 hospital healthcare workers in my hospitals during COVID wave between 2020 March. I saw my first case of COVID in 2020, March 27 there. So from day onwards, the government insisted to screen everybody with the shooting thing. We shooted. None of the healthcare workers, we shooted the healthcare workers before entering the hospitals, picked up 0. Meantime, almost 65 people admitted with COVID with the healthcare workers, I'm talking about it. And we checked the immunity because that time vaccine was not available. We checked the serological test. 520 people were positive. So the screening is a useless method. Nowadays, what we are using is, in Apollo's, what we are using is camera. If you want to see a healthcare person sick in the ICU, you don't want to go transmit your infections, what we need to do? EICU. We can contact, we can see the patients, we can speak. If the patient is speaking, you can speak. So camera will be there, the patients will be there, we can speak to the patients. It's called ELCU. That's a model we come up. So AI system is coming up similar to what the adaptive immunity. The old one is natural immunity. It's non-specific, not going to help you. Then where is your immune system? People ask, you are talking about immune. Where is my immune system? It is present everywhere in the body. I told you your skin is an immune system, your tears is an immune system, your saliva is an immune system, your blood cells. Particularly one type of blood cells is called white blood cells. Among the white blood cells, one type of cells is called lymphocytes. That is the policeman of your body. That is a policeman of your body. Everything is protective. Everything is an immune system. So if you destroy everything, you going to get infections there. Then can I find out anybody has got immune system deficient? Yes. If you got frequent infections, for example, your colleague is not getting that much infections, there's something I need to think about it. If you got a constant fatigue, for example, post-COVID, what is bothering so many people is tiredness. Previously, they're active, but nowadays they're not active. They can climb 3 stairs, 4 stairs, but even climbing 1 stair is a bit difficult. Second thing is digestive issues. People keep on complaining, I got indigestions, I got a lot of things is going around. Then anxiety and stress. Muscle shortness, weak and slow. For example, a couple of people got cured with COVID within 2 to 3 days. No need of hospitalizations, no need for ICU. But some people landed in ICU. Some people went into prone ventilation. Some people went into ECMO, one of the advanced form of ventilations people got in. So, but if you come to the ID doc, we can screen you, we can examine you, and we can say whether your immune system is good or not. We don't want any major things, we need to go for it there. But what is intelligence part of it there? We can't use, for example, most of the people, any cough and cold, what do you do? If you got cough and cold, what do you do? Go to the pharmacy shop, ask erythromycin. You know erythromycin, no? How many people doesn't know erythromycin? Everybody, doesn't know erythromycin. Oops. So everybody knows erythromycin. If you go to the pharmacy shop, you got cough and cold, you ask for erythromycin, you can give it. So you can ask it. Azithromycin, you change over there, very good. So it's next generation is coming to market there, that's fine. During COVID time, everybody know doxy, azithro, so that's a fine. So immunity intelligence. Intelligence means it's a common sense. Basically, it's a common sense. How intelligence we can define one term means, I can define this is my common sense. When to hit hard, when to keep calm. That's most important thing. I can't use my energy. For example, if I got a fight with my neighbor, I can't take my gun and shoot the guy. I need to know when to fight and when not to fight. That's most important thing. That is called immunity intelligence. That's what we are talking now. So why immunity intelligence? Corona we know. So COVID came. It doesn't bother about whether you are CEO, whether you are intern, whether you are a president, we do not know. Dengue does not skip your boardrooms. Definitely it won't skip. TB doesn't only go to the government hospitals. Amitabh Bachchan has got twice TB. He's a TB ambassador now. So don't think only for tuberculosis means lower socioeconomical group. People say it's a stigma. TB means it's a stigma. How can I get a TB? Nobody in my family has got TB. If you say TB diagnosis, I say nobody in the family has got. How it is related to the family, we do not know. Yes, if one person has got TB in the family, he can cough, sneezes. If you share the same person's room, you are going to get TB chances a bit high. But it doesn't run in the genes. More important thing. This is basically airborne disease, transmitted through the cough, sneeze and everything. So TB doesn't need only government hospitals. And immunity is an ultimate equalizer. Definitely Amazon cannot give your immunity intelligence there. You can order anything in Amazon, but you can't get immunity intelligence to Amazon. So far, I have not seen there. Anybody ordered immunity intelligence in Amazon? Books can come, but it won't give the real immunity for you. Then we are living in the Swiggy, Zomato, Netflix era. Your second brain is a gut. The gut has got more million cells and it protects you there. Unfortunately, people don't respect the gut. That's the most important thing. 70% of our immune cells is present in the gut. It has got access. It is constantly talking to the brain. That's called gut-brain access. Whatever you are eating, it will speak to the brain. It keeps the immune system commonly working. Antibiotics, whatever erythromycin, azithromycin you eat, that kill the gut bacteria. Your gut contains a lot of bacteria. More than number of people in the Chennai, number of bacteria is present in your gut. So the gut bacteria is killed. A lot of good bacteria are present. Don't say bacteria means bad. Bacteria is present in the gut, make your digestion easy, make your life easy. But what happened, unfortunately, what you are eating that kills the good bacteria, keep the bad bacteria growing. What is the end results? Not the diarrhea. We are worried about more of colorectal cancers. Colorectal cancers is going up because of your bad bacteria. An amount of plastics, what we are consuming as a microplastics there. So these are all the issues. Also, bad one will grow, good one will go down. Depends upon what you are eating. That's most important thing. But unfortunately, antibiotic does not know which is good, which is bad. I do not know in the figure which is good, which is bad. So similarly, the antibiotic does not go which is good, which is bad. It hit all the bacteria. That's the problem. And similarly, we live in the era of WhatsApp. WhatsApp University is a big university. Anything you want, you can quote the WhatsApp University. So people, flu spreads slower, but the panic spreads faster. That's a basic problem we are living in 2025. During COVID time, everybody knows it. And similarly, people say children does not have immunity. I'm 60 plus, why should my immunity goes down? We started without teeth. We started without hair. We started with diaper. Same thing, we are ending with the same thing. We are losing our teeth, we are losing our hair, we are losing our continence potentials, we are landing in a diaper. So both children and adults are behaving, particularly elderly people are behaving like a same thing. The immune system gone and immune system gone down. This is basic idea. And similarly, what is the impact of the infectious diseases? This is a real impact. 1918, we see, this is a word of 1980. 1918, not 1980, it's 1918. This is an influenza word. Pandemic of influenza killed so many people, but 2009 came back influenza, the death is not that much. Similarly, when you are studying in a class, one of your classmates is a polio affected. But now your children or grandchildren are studying, how many polio affected children are there in the school now? Polio is a travel vaccination. If you want to travel to Pakistan, Afghanistan, Africa, you need to take your polio as a travel vaccines. For India, we are doing for eradications only. Similarly, this is a ward called tetanus ward. So tetanus ward, I got posted in the tetanus ward, but now in government hospital, there is no tetanus ward. Because awareness is so much. Any injury people want to go to the doctor, take TT. Tetanus toxoid, I want to take it. Similarly, a lot of brain infections has gone down because of the vaccinations. So if we know how to use our immune system, we can get away with this type of diseases there. And before I set into the tone, this is a tone. This is the number of doctors who died during the COVID wave 1. So why this keynote one? I put just wave 1 only. I have not put COVID wave 2. Wave 2 is a bad one. The Delta wave in 2021, no oxygen, no hospital beds, no doctors, everything. This is wave 1, where a lot of beds, a lot of oxygen, a lot of things is available at that point of time. So many doctors within these publications happened in July 2020. I remember June 2020 or July 2020. Within 3 months of COVID came into the market. So what happened? Why so many doctors lost their life? The basic principle in infectious disease, this is a basic principle. That's called standard precautions we can call. Assume everybody has got COVID. That point of time, the doctor should assume everybody. People like me, we worked in the COVID ward, we didn't get COVID. People who didn't work in the COVID ward, they got COVID. Why? We assumed everybody has got COVID when I went into the COVID ward. People say, I don't want to go to the COVID ward. I don't want to get COVID. So people working away from the COVID ward. So they say, I'm seeing not COVID cases only there. It's very difficult to predict. The idea is standard precaution means assume everybody. For example, if I'm going to draw a blood sample from you, I need to think your blood contains HIV. If your blood contains HIV, what I need to do? I need to wear a glove. But by the way, don't worry, we treat 25,000 patients with HIV. We don't stigmatize, we don't discriminate. In my OP, if I come there, 15 people are sitting, 3 people is HIV. Who is HIV, who is not HIV? We do not know. We don't discriminate. We don't. We do for bypass. We do everything for HIV patients. HIV is nothing now. It's very easy to treat HIV compared to diabetes. Diabetes needs so much of medicines, so much of investigations. HIV needs once in a year testing. The cost of the pill is only 1 pill, not even 10 pills, only 1 pill. Now injections is coming to the market. If you take on injection, 6 months it will work. So HIV is getting a cure also. So don't think about it. Assume your blood contains HIV. If your blood is containing HIV, I need to wear a glove. Unless I wear a glove, if some needle stick happened to me, I'll get HIV. So this is called standard precautions. Unfortunately, the doctor lost their life because they do not know what is standard precautions. So what affects your immunity? These are all the things. Genetic makeup. People are calling, why I am getting so much of infections? Why my infection is severe? Don't think, don't blame. Your genes should be blamed there. Your age, I told young people and older people. People got comorbid conditions. For example, you got a diabetes, poorly controlled. Yes. Your habits, I'll come back to the habits. Long-term stress and poor sleep. Most of the CEOs, how much hours they're sleeping? 5.5 hours. Your vaccinations history, pandemics. So this is your boost your immunity. A lot of talks is going to happen with my colleagues, so I don't want to take time on this one. What affects your immunity? External factors. The food you eat, junk food, all your pizzas and burgers. Anything is white is bad. People say, the vadivedha comedy. வெள்ளையா இருக்கிறவன் பொய் சொல்ல மாட்டாங்க. But வெள்ளையா இருக்கிறவன் சாப்பிடக்கூடாது. That's a thing there. That's a moral of the story. You need to do it there. So all white is bad for you there. So this place, anybody can guess what is this place? I give a clue. So any guts, any thoughts? Anybody from South Chennai? This is alma mater for me there. People worked in government setup. People learned the medicine. People learned that this is a setup there. This is called the famous TB sanatorium. The TB sanatorium, if you cross the Tambaram area, the sanatorium will be there. And this is a famous ward. In 2002, 2003, we see a lot of HIV patients. Each bed is occupied by 3 HIV patients. There is no beds. 100 and 150 patients of HIV will be there. All sorts of infection. They are the most immunodeficiency persons we can encounter. For example, I told the white blood cells. Normal white blood cells is 6,000 to 10,000. 4,000 to 10,000, you can keep it. In that, the lymphocyte count is almost 1,500 to almost 1,000 to 1,500 is the lymphocytes. When I saw the patients, first 250 patients, we started the medications. What is the lymphocytes? Any guesses? 0. The HIV killed all the lymphocytes. The person presents without any immune system. They're vulnerable to any infections. If you cough, you can pick up anything there. So that's the populations we encountered in 2002, 2003 because the medication was not available. They waited for a good medications. They tried Ayurveda, Siddha, everything. Immune system gone down. They started with the CD4 count of 0. So we started the medications. The person slowly improved. That's what it happened to them. So what's the point I'm telling? Why people in 1975, what is the treatment for TB? Anybody? Yes, put him in the sanatorium. Give good ventilations. Yeah. 2 eggs in the morning, 2 eggs in the night, 6 glasses of milk. Now I am giving lot of TB medications. TB treatment first is the nutrition there. Take 2 egg whites or at least 3 egg whites, 6 glasses of milk. If you eat, yes, TB is cured. Put in a sanatorium, provide a good air. So ventilation system. This ward constructions, people does not know how to construct the places there. Tall ceiling, opposite window, it dilutes the thing. But now people are putting air conditions, people are removing all the things in all corporate hospitals. But what is required is this is a simple logic. So ventilation is a way forward. I can show the ventilations. So this is a people living there here. So this is a complex flats. Everybody wants flats, security guard, 24/7 power supply. But what is way forward is homes is good, house is good. That's most important thing. We need to live in a forest. That's the best way because I need to have, when I was young, I used to grow a banyan tree in front of us there. But now I'm living with at least neem tree in front of me there. So I need to take like a bath in well water. Unfortunately, nobody well is available there in Chennai. And we need to like have a tall ceilings. Sunlight should wake me up in the morning. And my dresses should dried in the sunlight. That's the best anti-infective thing there. But most of the thing, the flats are showing your dresses are dried up in a closed room there. But my dresses are dried up in a sunlight. That's most important thing. And people say, wash your hands when come back. Why? When you go there, people are coughing, sneezing, laughing, handling a lot of things. You wash your germs. Whether Lifebuoy clears your bugs or not, ordinary water can clear a lot of bugs. So wash. These are all things the ancient Tamil people know very well what they need to do. All are applied, but unfortunately we lost the thing there. Apply these concepts. If you apply these concepts, you can get away with it and your immunity is good. And this is a toilet system created by architects. How many restrooms and bathrooms has got this type of open windows? We are treating in a 6x3 there. But I take bath in my sunlight, I take bath in my moon, so my bathroom roof is like a roofless. No can. This is the roof I am seeing there. This is the thing I'm taking a bath in my sunlight there. I take in a rain bath, which is nothing there. So what is needed, whether you take a sun bath or moon bath, take a Saturday oil bath. That's more important for me. It gives a lot of microbiome, massaging, improving your blood supply, giving a lot of nutrition to the things and remove more dirt also. That's most important thing. You need to apply pressure over it there. So take a Saturday oil bath there. And this is a traditional Indian food, fermenters. All Indian things are applied there. How the fermented idlis and dosas, what we do is good for your health. Unfortunately, people gone into pizzas, burgers and barotas there. That's more important for us. I think next speaker can allude more on it. I can't speak this one. So this is what our microbiome. I'm worried about my microbiome. I don't worry about your barotas or pizzas. I'm worried about your microbiome. I told gut is your second brain. It contains more bacteria compared to any other things. So the bacteria are helping you, digesting you, preventing cancer from you. How you are getting cancers nowadays, 30, 20, 40 is more common because of the habit what we are eating now. Why it matters? So almost all Swiggies and Zomatos, any restaurants, these people are standing in front of you, delivering you. But unfortunately, my grandma's cook or my mother's or I put my thing is wifey there, best cook in my home. She is the best person there. I never eat out there. She take care of my food there. So how to protect and improve your gut? Eat natural fiber-rich foods. Fermented foods is required. Curd is more important. Buttermilk is more important. Limit processed food there. Sleep well. Move your body. Anything prepared by your mom, grandma, or my wife is better than that. She is good. That's what I can say. And this is a thing, if you go Saturday, couple of areas I can put in Chennai. Can you label which is the worst areas? Which is the worst area? People are eating lots. Everyone in Chennai. But rank it. Anna Nagar comes first to me there. All restaurants you can't get into the 6 or 8 o'clock in Saturday night. Next one is Srinagar. So people knows all restaurants we need to wait for minimum 45 minutes to entry there. Even pre-booking is not allowed now. So people are doing this one there. So what is the secret of long healthy life? I'm coming to the conclusion part because I'm taking so much of time. How to live not 100 years. How to live 115 years. Now the aim is not 100, 115, 120. So people are restricting to 100. You need to live 115 to 120. Vaccination is the way forward. Vaccination is the way forward. Healthy eating is the way forward. So this is a screenshot. If you are above, I think Dr. Madhu will talk about this one. What are all the vaccines required for you people? Clearly shown about it there. So if you take vaccines, you can live up to the 115 years of age. 115 years of age, that's guarantee there. Be aware. Know the warning signs. Fever, fatigue, throat, rashes, yes. Early testing may be required. Avoid unnecessary antibiotics. That's the only take-home message I can say. I'm an ID doc. I never write antibiotics. If I go see 10 patients in me, refer to me. When I go, stop antibiotics. Stop antibiotics. To write stop antibiotics, we need a lot of guts. That guts is there with infectious disease docs. And a lot of pressures. Pediatric doctors, every day, mothers and pressures, parents are putting right antibiotic. Antibiotic is not a sweet. So this is the same take-home message what we taught in our schools. safe water, good ventilations, good sleep, eat healthy, you'll be all right there. So what is the way forward? Because this is a management guys I'm talking there. So what is a problem? This is a problem I told. This is the solutions involved. For example, constructions of your office needs a lot of thought process. How to construct your office, how to construct your rooms, how to do when you got an outbreak, what you need to do. We need to have somebody supporting system like ID docs can help you out there. So keep in mind this is a way forward. So no lockdowns, no confusions, and smarter and healthier life. Resilient organizations need by somebody thought process. So the key is always alert. Put your vaccinations, not a mask. Mask is also needed. Put your mask when it's required. So that's the take-home message for you. That take your vaccinations, what is required for you. Eat at a right place, at right cook and right food. I know yesterday some marketing mixology meeting has happened there. Somebody attended, so they will fear today what is immunity is going around there. They are taking the questions at the end, happy to take the questions. Those who want to learn more about infections, immunity, this is a message, you can send it to you there. Screen it, you can get a lot of information there. Thanks for the opportunity. I think we overshoot it there. Thank you very much.
Namaste, good evening. I hope you all had a good evening snack before walking in. No, only I didn't have. All of you had. Thank you, Captain Vijay Kumar, for the invite. Thank you, Dr. Suresh, for connecting me with Captain Vijay Kumar. So, Dr. Suresh did give you hints as to what is important. So in his line, I'm going to continue. Eat to beat, fueling immunity with intentional nutrition. What is your intention? Is it junk food or healthy eating? Healthy eating, good. So that makes my life easy. So how strategic food choices elevate immunity, focus and energy. This is what is the topic given to me. So, whatsoever was the father of the disease, an ill diet is the mother. Yes? How many of you agree with me on this? Only a few hands are going up. You're all very good people who eat all healthy stuff, is it? Because any, disease condition you take, whether it is a cardiac or a diabetes or any non-communicable diseases, you will find an ill diet being a causative factor. And diet by itself can become a preventive or a healing diet also. So it is intentional eating, right? What you pick up is very, very important. The food that you eat can either be the safest and most powerful form of medicine or the slowest form of poison. What are you choosing? It's up to you. And why are we talking so much of, on immunity, good eating habits? It's all to make sure we live long and we lead a healthy life. And you should know that nutrition plays a pivotal role for longevity, significantly impacting life expectancy and quality. And when we talk about nutrition, it is a holistic approach. It's beyond the meals that you eat, because you need to integrate it with lifestyle, whether it is stress management or physical activity or your sleep pattern. It all comes together in order to lead a healthy life. And when we talk about intentional eating, what you pick up has to, connect with your performance, your immunity, and it should really give you some clarity, not, fogginess. So Dr. Suresh did speak about immune system. I'm not going to go much into it. It is related to gut, and gut, when you talk about gut, it is related to your food. That's the main place which digests. So whatever we eat, makes a big difference to your gut health, and there's a lot of research going on in this aspect. And the solution to improving or sustaining a better immunity is, one is exercise, the next one is sleep, and last but not the least, the diet is very, very important, and that's the 3 components which you can control more than anything else. So it can be good food for your gut, and those food items which can strengthen your immunity. As Dr. Suresh mentioned, there is a close connect between gut and brain axis. Gut and brain talks to each other like how we talk over phone. So when your gut is happy and healthy, overall system is happy. So when you look at the microbiome, our system is made of 100 trillion microbes, more than the human cells. So there are good bacteria, bad bacteria. You need to focus on good bacteria. So eat at least 1 meal every day to strengthen your immunity. The first thing that you need to do is the probiotics. Doctor did mention about fermented foods. Yes, of course, a healthy gut microbiome is essential for immune function, nutrient absorption, and overall well-being. Incorporating fermented foods. It can be idli, dosa, curds, or anything that is fermented, even palaya sadam, right? That's a fermented one. So all these can be part of a good eating habit, but as discussed, we are drifting away from our traditional eating habits, right? Maybe out here we don't have very young people. Yeah, some of them are young. The younger generation is just totally drifted away. Maybe we still have some connect with our traditional foods, because that has an impact on maintaining the gut. The prebiotics is nothing but the plant-based food. How many of you regularly have vegetables at home? Yes? See, there are few hands not going up. Evidence. Okay? So, these, vegetables or plant-based foods they are not digested. Okay? These are the fibers that we are talking about, and it remains in the gut, and it becomes a food source for the good bacteria. Doctor did specify that we need to focus on improving the good bacteria in the gut. So how do we do that? By encouraging ourselves to have good amount of plant-based food, because that becomes the food for the good bacteria, because there is fermentation or, digestion, it happens, and these fibers are converted into short-chain fatty acids, we call it, which is nothing but the food for the good bacteria. So at least 1 to 2 servings every day is important. So how do we strengthen our immune system? By ensuring that we have all these nutrients in our plate. It can be vitamin A, C, D, zinc, selenium, omega-3 fats, and last but not the least, the protein. So ensure that you have vitamin A. How does that happen? We all know vitamin A is required for vision. Yes? But more than that, it is important to, maintain immunity. Vitamin A is required. So how do we get this from food? Animal sources being, dairy products, poultry, fish, or shellfishes, egg yolks. So vegetarians, you can ask me, hey, don't leave me. Vegetables, all colorful vegetables have beta-carotene, which can be converted into vitamin A in the body. So carrots, squash, pumpkins, name the colorful stuff, leafy vegetables. These are all good source of vitamin A, which you can have. Have a variety so that you're not bored. Moving on to vitamin C, this had a lot of, boom during COVID, if I am right. All of you would have had a vitamin C pill every day. But take it from me, simple things, citrus fruits every day. It can be oranges, mosambi, gooseberries, simple stuff. Every day ensure that you have a portion of these, because this also helps to block the entry of microbes into the system. That way you become more stronger. And vitamin D, I can tell you, preventive health checks, if you look at, vitamin D deficiency is on the increase. And people are treated for it. Okay? And how many of you feel fatigued when you go back home? You don't feel like getting out of bed in the morning? I do. You guys don't do? Yeah, there's Lakshmi there. Okay? So that is one of the symptoms. Okay? Many of us have that. Maybe we don't really give a damn to it, but it has an impact. Check your vitamin D, and the food sources being fatty fishes, milk, eggs, cod liver oil, fortified cereals. Why are we talking about it? Because when your vitamin D is low, you are more susceptible to infection. And moving on to zinc, these are the animal sources and plant sources. Animal sources, the usual stuff, and plant sources, a handful of nut every day. In this hall, how many of you have a habit of taking nuts every day? Does that become part of your snack in the meetings? That's one habit people have of late. Every day, make sure you have a handful of nut. It is about 30 grams. It can be almonds, walnuts, peanuts. These are all good stuffs. Any combination nuts are also okay. And zinc deficiency leads to a change in your taste buds, smell. So these were also symptoms during COVID, right? Still it is continuing. That's what Dr. Suresh mentioned. Selenium per se, it is nuts, brazil nuts, seafoods, eggs and whole grains. This also supports to, prevent from oxidative damage. And finally, omega-3 fats. There's a lot of talk about omega-3 fats. A decade back, they used to talk or correlate with heart disease, correct? And now, we do talk about this because it has an impact in minimizing the inflammation of the body. So, avoiding non-communicable diseases or postponing them, this has a major role to play. So, if you are a non-vegetarian, I would encourage you to have at least 2 days of fish, fatty fishes. But don't fry them. Use it as a gravy or a grill, that would help. And if you're a vegetarian, I would encourage you to have walnuts, because walnuts are also good sources of omega-3 fats. And why are we talking about omega-3 fats? Because it helps to restore balance of the healthy microbiota. It has a relationship with gut, decreases inflammation, and strengthens the integrity of gut wall. Anti-inflammatory diet. It's nothing but foods rich in vitamin, antioxidants and omega-3 fats. So we did speak about vitamin A, D, E, K, which are nothing but the antioxidants, and omega-3 we did specify about fish and nuts. All these put together helps you to minimize inflammation in the body. Last but not the least, the protein. How many of you regularly have protein in your plate? Because it's a question. 9 out of 10 Indians do not have adequate protein. Simple. We don't even realize that we don't eat much of protein. Take it from me, it's about 0.8 to 1 gram protein per kg body weight. If you are 50 kg, you require at least 50 grams of protein. Ensure that you have your dal, pulses, your milk and milk products. If you are a vegetarian, only these two sources are, giving you protein. If you are a non-vegetarian, you have a longer list. You have the non-vegetarian sources, which really helps you to boost your protein. Because too little of protein, makes you feel weak, fatigued. You feel your immunity also goes down. That is why we encourage you to have protein in every meal, as well as It's not that one meal I have, I'm done for the day. It has to be split throughout the day so that the assimilation of protein is much better. Unless, if you're avoiding in one meal and focusing on one particular meal, it doesn't work well. Why are we talking so much on food? Is because chronic diseases are related to your dietary habit. Whether it is coronary heart disease or stroke or cancers, atherosclerosis or type 2 diabetes, where we are, heading the table. How do we tackle such issues? Increasing physical activity is a part of equation. Reducing weight or the calorie, the energy that you take is the main key as such. Unless you restrict on the diet that you eat, you won't be able to maintain your weight. Calorie restriction and aging goes hand in hand. Research proves that moderate calorie restriction without, becoming malnourished is vital as you get older. Ensure that you take, energy, nutrient-dense foods which are portion-controlled. So this is how your plate should look. How many of you look at your plate which looks this way? It should be half a plate of veggies, quarter plate of protein, and quarter plate of your carbohydrate or your basic cereal. Many times in South India, we eat half a plate or 3/4 of the plate with rice, correct? So it is important that we control the portion of carbohydrate or energy-dense food, which is very important. And the next important thing is the size of your plate. Don't count on a thali plate. It is a small size 9-inch plate. So there are so many diets are available. You Google it out. There are 1,001 diets, whether it is paleo or keto or name it, it's there. But how impactful it is in the long run is a big question mark. A complete balanced diet is what is a simple long-term solution. Bringing all the nutrients together in your plate in appropriate quantity is important. And this is the dietary recommendation where you find the base is your cereal and the top portion is your fat, which is going to be minimum. Which is the right way to eat to ensure that the foods that provide you with a lot of vitamins, minerals, and other health promoting components with little or no sugar, salt, and saturated fat. 3S. These three are very important that you cut down. Sugar, salt, and saturated solidified fats. How do you ensure that all these are part of your routine? By increasing vegetable and fruit intake, choosing whole grains instead of refined ones, using low-fat dairy, varying your protein sources, and limiting on the 3 S's that we discussed. So this is the plate that I want you to carry home. Half a plate of veggies. So it takes care of your prebiotics also. And smart snacks, your nuts, your sprouts, your eggs, and never have, long gaps between meal. Because you might have a very low spell, your sugars can go down. And why we talk a lot on plant-based foods is because it has a good impact in maintaining your weight because of the fiber. It reduces cholesterol, it helps you to maintain your sugar, and overall inflammation of the body comes down with good amount of fiber. So at least eat 5 a day. 5 portions of veggies. It's a tough task, right? Every meal, make sure you have 2 cups of veggies and at least 1 portion of fruit every day. So it makes up to 5 cups. And why we talk so much about veggies is because of the fiber content, which really makes a difference in your overall health. As we discussed, it helps to improve the gut microbiota, especially the good microbes. So the sources being whole wheat, nuts, beans, leafy vegetables. And processed food has to be minimized, and whole grains or, foods which are whole, less processed are much better. And that is why we encourage a lot of millets. But I tell you, it is not possible to completely change to millets. At least weekly, once or twice, if you could have, it should be perfectly okay. And as we discussed, the 3S has to be nullified. Don't prefer to have processed foods. And especially these drinks. Because, you see, we don't eat so much of sugar, but why do we drink so much of sugar in Coke and Pepsi? Swap it to a good alternate. It can be coconut water, buttermilk, or some clear soups, which are healthy and it will not harm you. And emphasize is on protein, but not on the powders. There are a lot of youngsters who go with protein top-ups. It can be dangerous because they don't really connect with a clinician before taking it. So refrain from having extra protein top-ups unless it is prescribed by a dietitian or a doctor. Use a combination of oil, that is better, and use 25 to 30 mils. And those oils which are high in monounsaturated fats are much better. And hydration is very important, at least 8 glasses of water every day. And ensure that you do exercise at least half an hour, 5 days a week. How many of you are fitness freaks here? Okay, minimal percentage. So it is important that you do at least half an hour every day. If you want to lose weight, it has to be doubled. It is 300 minutes, per week. It can be any form of activity, walking, jogging, dancing, cycling, name it, whatever suits you, whatever you feel is very comfortable to you, make sure you do it because it has an impact on, your energy expenditure because you need to balance your intake with your output. And sleep, as Dr. Suresh discussed, people sleep only 5.5 hours, right? Especially people who are in a management cadre. But erratic sleep habits also has an impact on immunity. So it really stresses your body, the cortisol or the